Okay, so I am basically an endocrinologist by profession, and I am involved in uh, practice, research, and academia, all as a part of endocrinology. Now, this forum is neither of the three. It's neither research nor academia, neither practice. It's a forum which is a part of our passion. It's been activity which all of us, all the faculty have been involved with. We have involved this concept and this practice of mind body medicine as a part of our passion. Each one over here is very passionate about this topic. Now, why specifically I am involved is what I'm going to tell you, because everybody, you will hear them at their own speeches why they are into this mind body medicine forum. Now, when I'm talking about hormones as an endocrinologist, we know that the brain is connected to the body in terms of the mechanics, anatomy, physiology. But we also understand the mind is also linked to the body. We know that when the weather is gloomy, your mind is not happy, your body doesn't respond that well. So you know this is a fact. Now, what connects the mind to the body is the question. There are two systems which connect the mind with the body. One is the brain and the nervous system, and second is the hormones, because hormones tell you how you are feeling. So, say my adrenaline is high, I know I am excited. So, my cortisol is high, I know I am stressed. So, that is why my body responds to it. So, that is how hormones are linked with mind. So, there is a connection between mind and body through the nerves, to the brain, to the hormones. And if I am treating any hormonal problem, if I am treating only the body, I am neglecting the other aspect of the treatment. So I am neglecting the mind as another aspect of treatment. So this is how we started developing interest. So you see that today we have faculty with neurology, faculty with neuropsychiatry, faculty with physiology, because all of us have come to a common understanding that if the mind and the body has to function in synchrony, you have to take into consideration a hormonal health, a well-being, a neural health, and overall a mind-body health. So this is how the whole linkage in terms of medicine is. So there are some basic housekeeping instructions that I feel is a necessity for the group. I will give those instructions once again before lunch, because we will have new people joining. That this is not a group for spiritual activity, for wellness training. It is not for having a, say, art of living or Sadhguru or any lectures or Guru Baji. This is a purely a science forum. We are not talking about caste, religion, Hinduism, non-Hinduism. It's a purely academic forum where we understand our own fields very well. So I understand endocrinology, madam understands physiology, sir understands neuropsychiatry, nutritionists understand the nutrition aspect. So we are going to talk on what we know. We don't know about other things of religion, spirituality. We do pay a lot of respect to all these. So I would recommend and I would request that if you all are followers of XYZ gurus or sects or religion, please restrict those talks in this forum, because the session for 4 days is going to purely focus on academics of mind body medicine and of course practical aspects of the same. So I'm sure that you understand the implications of this, that we don't dilute the topic of our presentation and our you can say the purpose of having this meeting. So this is my formal introduction. I am an associate professor in endocrinology at Sassoon Hospital. I am the consultant and head of endocrinology at Dinanath Mangeshkar Hospital and Deshmukh Clinic. I have been a part of numerous conferences, and majorly our NGO sphere, which you saw the video previously, the non-government organization, it's a non-profit organization. It's mainly focusing on three mottos. One is women health, second is mind health, and third is prevention of non-communicable diseases and cancer. So this is how we are functioning, and mind health, this is one of the activities. We do have a lot of experiences in this field, and we have started with mind-body medicine research, and we have had neuro-behavioral endocrinology symposia. we've had, I'll come to that, we have had a workshop last year. It was very successful in the same place. And so just to brief you on some sphere activities that we do. Can I have the next slide, please? The sphere activity slide. So sphere stands for prevention, P stands for prevention of NCDs, H stands for healthcare, E stands for education for community, doctors, nurses, paramedic organizations, society, industry and institutions, and R stands for research in non-communicable diseases and cancer. So basically the focus of our society revolves around these things, and being an endocrinologist and Dr. Chetan Deshmukh being an oncologist are special areas of interest being in the respective fields. So when you're talking about the mottos, as I said, these are our key mottos, and this is not working. So our journey has began with laying a conceptual framework of this whole thing, followed by translation of this concept further into the practice, and then training and education for which we are here today. So the concept basically has been laid through these conferences. I'm sure quite a few of you must have attended the conference this year also. And you must have found that Synapse is now a brand in itself. So we began in 2020 with laying this concept initially. So nobody spoke of this in modern medicine. So we started speaking about it with the help of eminent leaders across the globe, followed by 2021, which focused on behavioral interventions. So when we are talking about lifestyle diseases and cancer, we are talking about lifestyle intervention. Then we spoke about how the wheel of health requires a lot of interventions which is beyond therapy per se, beyond drugs itself. And then as the concepts grew, we spoke on network science, how different, you can see today we have people coming from different specialities. So we are networking now. So we are networking with AI engineers, we are networking with IITians, we are networking with our academia people and many more on this grounds. And the concept of the PNIE model that I will come to later as I get an opportunity to speak on that, the psycho-neuro-immune endocrinology model, followed by the CGI health, that is comprehensive global impression of health, and then now concept of autonomic health. So we'll be hearing all these things. So finally, these are new terms, but for all of us it means one thing, that health has a measure. And health measures are what we are not trained as doctors. We are trained as doctors to identify disease, not wellness. So we need to learn that when I am treating a disease, not only I have to treat the disease, I have to also make that person healthy. So just by getting the sugar under control, I am controlling the diabetes. That doesn't mean that I am making the person healthy. I have to give the person health in the bargain of getting his glycemic control. So this is what is the final aim. So the first conference focused around the concept, second conference focused around the assessment technology. How do I know that his or her health is not normal? So this was what was the second concept. Third was, okay, if I have identified how the health is abnormal, how do I treat it? How do I intervene into that as a doctor? And do I need stakeholders into that? So do I need additional people? Like I need a dietitian, I need a healthcare professional, I need an educator, I need many more people to help me as adjuvant. And this year we were focusing around different research works that we have done in assessment of health. So this is how we are trying to. So why is this more important? Because finally, to conclude, we know that mind-body medicine is an adjunct. It is going to be a need. So only treating sugars is not going to help. Only treating thyroid is not going to help. Only treating cancer is not going to help. You have to help the patient with other adjunctive therapies so that the person has the sense of well-being, and there is a need for improving this. So you can see that the role of mind-body medicine. So the role of mind-body medicine is the base of all the disorders. So you see that this is very common, that diet, exercise, relaxation to begin with is the pyramid most of the time. But tell me, if my mind is not healthy, will I follow a diet? No. If my mind is not healthy, I will not feel like exercising. If my mind is not healthy, I will not listen to what my doctor says. So I tell you, yes, you start relaxation. Are you able to relax? No. So you have to work on mind health of the subject before you even advise diet, exercise and relaxation. So that's the whole premise of this whole concept. And how have we started operating on this? We will hear more about this. So with HRV studies with Dr. Leena Fadke in the lead, then cardio autonomic studies, the CGI health and CGI diabetes, where Fadke sir has been our major mentor for that. Then PNI assessment studies being done in our own clinics, yoga and autonomic studies being done with our collaborators. So then, important task which has begun this year, the credit goes to Dr. Priya Madikar and Dr. Leena Fadke madam, to start a mind-body clinic in an institutional level. So it has begun in Navle Medical College, and I think she and I feel proud that it's running on well. And people have appreciated that beyond a psychiatric OPD, there is something called as wellness OPD. And I think that is one thing which was very new to most of the people, that wellness has never been taken into seriousness in any hospital, because hospitals are focused only on illness. But here we are talking about mind-body clinic which is focusing on wellness and health and not on illness. And that's a very good start and a good encouraging movement. And of course our patient workshops have always been successful. They are more in demand because patients are the ones who can relate to all these things better, because they have suffered both illness and lack of health. So they are the ones who know the importance of both, not having the illness and getting good health. So I think these are the things that we have, and this is what I was speaking about. So we have now in publications, we have different chapters written in. Fortunately, I am proud to say that the Endocrine Society is very proactive in taking this concept. We will be having one of our eminent leaders, Dr. Manoj Chadda sir, eventually joining us. But they have been very proactive in taking this concept of mind-body medicine to the books, and PNI is now in the books, and we are working on yoga collaboration and yoga publications with our US collaborators too. So we will hear more on this digital innovative solution of HRV. This is the tele-HRV which our team is now promoting. So this is the team working on this tele-HRV, and the tele-HRV, we will see the device also over here. If you all want to do your own HRV also, you all are free in these 4 days. You can let us know. HRV is what? Heart rate variability. Now heart rate variability is the earliest marker of ill health. So whenever a person's homeostatic mechanism is threatened, the first thing to sense is your autonomic nervous system. And the first thing in the autonomic nervous system to sense is the heart. So heart rate variability is the earliest marker of abnormalcy. It tells us that your wellness is shifting towards illness. You may not be ill, but it is shifting towards that. And I think having something to assess that change of wellness to illness is a very important task, and this is what has been achieved with this device. And it has actually helped us to pick the cardiovascular disease at an earlier phase. So this is the device. I'll show you the device later on. So these are our papers. These are the awards received for the same invention, and hopefully we'll be using it in the market and in your clinics. So now it has occupied a space in the wellness clinics, in the doctors' clinics, in the research labs, in the mind-body clinics, and even in the clinics of NCD people. So everywhere it has been a technology which is going to be useful. Now this has been one of our important acceptance, so 2-minute mind-body questionnaire. So 2-minute mind-body questionnaire is what we have designed for our own clinics. We have done this experiment in our own OPD, in the waiting room. We have given a one-page tear of pad to the patient and asked the patient to just tick 10 questions. And it is as easy to assess whether this patient's mental health is normal or abnormal. And that has been accepted now. And this has been our own assessment strategy. So this is last year's workshop, the fellowship which we had done last year, same place. And it was well enjoyed, attended, interacted. This is an interactive forum, it's not a one-way forum. So this is the last time I am doing so much of talking here. So the talking is going to be done from the other end. Just to give you an idea as to what we did for last 4 days last year.
Happy that I attended this mind-body medicine workshop for 4 days here. It was a wonderful experience and learning experience for not only for myself, even I can take this experience to my patients who are suffering from lots of lifestyle diseases.
I had a privilege of being a part of this wonderful workshop which talks about what we can do for a diabetic mind using masterminds. Now, the best part of this workshop was that it was very interactive. Though the number of delegates were about 10 to 12, but they were very much interested in this particular topic, and the kind of interaction we saw was wonderful and amazing.
This particular workshop has been a very useful one because besides me, imparting my knowledge, I learned a lot myself.
मला ही संधी मिळाली माइंड बॉडी मेडिसिन म्हणून जी डॉक्टर वैशाली देशमुखनी कॉन्फरन्स अरेंज केलेली पुणे येथे ॲव्हेनोरा पार्कमध्ये 4 दिवसाची ती अटेंड करायची मला संधी मिळाली. इट वॉज अ एक्सलंट कॉन्फरन्स, अ टोटली न्यू एक्सपिरियन्स.
This is a platform which is not there in the textbooks. Nobody is going to teach us, nobody is going to write a book on how this, and we are not going to become babas or sadhus if we come to mind body. There is a scientific basis, a scientific technique which we are supposed to learn.
There was a lot of give and take in this workshop. It was excellent being a part of this workshop. This is a must-attend workshop for all the paramedics too, I feel.
I've become a fan of this whole process and would love to be a part of this again and again.
I will definitely say that this.
So the video actually showed that a lot of people from the audience were speaking. You hardly saw me over there. So a lot of faculty is there, and the faculty is an eminent faculty. They are experts in their own field. I'm sure all of you all are also experts in your own field. So it is a forum to open your hearts to talk. And before I start with the faculty introduction, we are waiting for all the faculty to come. But we would like to start with introduction of each and every delegate and why you want to be here, why you have been here, what made you register for this, what made you. I'm sure nobody's forced you to come here. So that is very much. And actually yesterday when it was raining very heavily, I had a worry that people might drop out. But then a lot of people told me that they wouldn't have registered had they not been interested. And they knew it was rainy season, and even then they are interested, and that's why they will come. And that's what I see today, that there's an overwhelming response, and I would like to learn more than talk more. So I will hand over the mic to the tables, and you can come here and talk about yourself, talk freely. Nobody is going to, this is all going to be in our recordings, not shared with anyone. So you can open your heart, and it is, we have actually prohibited everybody from recording and taking photographs. So please don't take any photographs of the audience. Whatever recordings and photographs, we have our own photographer. They will do the needful if required. So one more instruction to the pharma and to the other delegates, non-delegate people, is that try and avoid more of disturbance. Don't use your phones in the hall. If you all want to talk, please use it outside the card room, not here also, because here also the voice is the voice comes in. So you can talk outside the room door. So I can now safely hand over. I will come back to introduce the faculty, but I thought that let us know the audience first. So here we started. You want to start?